So we're taking a look at what Time has done. Time magazine did a special report called Why Medical Bills Are Killing Us by Stephen Brill. And I'm here with Sarah Hart, who is my running mate and vice presidential candidate. Hello, Sarah.
Hello, everybody. Yes, we've done some thorough research looking at this news article by Time magazine, and it's just unbelievable what's happening with the costs of healthcare.
We're going to take a look at the article right now. We're going to look at it, go to the big page, and take a closer look. Tell us about this article.
So some of the things that this author has done is actually look at cases of overbilling, or they would say just regular bills. But for instance, one thing, go to the next page,
Sure.
is that this couple right here, Sean, I believe his name is Ricci, he was diagnosed with non-Hodgkin's lymphoma at age 42. His wife her father had actually gone to MD Anderson Hospital in Texas, so she wanted her husband to get the best care. So she took him there, and when she did, they had huge medical bills that basically they said they wouldn't take their insurance, even though they were insured for hospital bills up to $2,000 a day.
$2,000 a day they had insurance for, and they wouldn't take their health care insurance at MD Anderson? Wow.
Correct. And in fact, so she borrowed the money from her mother to actually get him the care. Mm-hmm. She had to borrow, it's on the first page, she had to borrow money from her mother to get him the care. The first day, just for a 6-day treatment plan, in order to get him checked out, they had to borrow $48,900 just to be examined.
Just to be examined. Their total bill to be examined was
and then
$85,000 total. Yeah, go ahead.
6 days later, they had to borrow another $35,000 because they said, "Oh, this is serious. He needs to get treatment right away."
Now, on the bill, they saw gauze pads for $77, folks. A charge for gauze pads.
Just for a little box of gauze
pads. Just for a little box.
You can pick up at the store for something like $7 or less.
This was diagnosed a person who had lung cancer who spent $348,000 on their bill, a $77 gauze pad box. Another person had a heartburn bill of $21,000. Yes. Let's take a look at this.
This lady, she was 64 years old, mm-hmm. in Connecticut. She called the hospital because she had chest pains, mm-hmm. and they had 3 hours of tests. She ended up with $21,000 bill because she obviously thought it was a heart attack.
Oh, yeah.
And they did some tests that they didn't necessarily have to do,
right.
But because they're afraid of being sued, mm-hmm. they wanted to do every single test that they could.
Now, this woman paid $21,000 for heartburn, folks. Let's take a look.
She's still paying on it, by the way, in monthly installments. She's still paying on it. Oh, by the way, if you scroll up here and
sure.
Zoom into these highlighted things,
sure.
These are each strip for diabetes, mm-hmm. to test diabetes.
$18. Oh my goodness! Look
now,
at this.
By the way, they did deduct. If you want to zoom in a little bit more, they mm-hmm. did deduct a Surgicel, $451, but still $18 for a little diabetes test strip. It's really ridiculous.
This is the medical technology's perverse economics that we're reading, folks. Out of Time. Anything come to mind? MRI scans, when they might not be medically necessary, routinely are incredibly expensive. Let's take a look at this. They standing at the ready to make sure Congress keeps Medicare at bay is, among other groups, the American College of Radiology.
So basically they're saying in here there's been a lot of lobbyists, mm-hmm. that if you scroll up in the middle here, on one of these pages it says, for every congressman, there's actually something like 7 lobbyists in the healthcare industry that lobby for medical
reasons.
Yeah. And some of the other things is that what's really ridiculous is a lot of these hospitals claim to be non-profits, and the non-profits, so they don't have to pay as much pay taxes.
They don't pay any taxes,
and they are making more money in many instances than the for-profit hospitals.
Right.
And another issue also is that the CEOs of the non-profit hospitals, especially when associated with a university, they get paid more than the president of the universities.
Oh, I know. Yeah. In fact, lobbyists have been getting $5 billion. Have been getting $5 billion from the medical healthcare industry, as opposed to $1.5 billion from military industrial giants and about $1.5 billion from the oil industry. So lobbyists get the most money from the healthcare industry. This is an article by Time that focuses on MD Anderson.
No, this whole entire thing is the same article by Stephen Brill, and the it's not just MD Anderson. He looked at hospitals across the country, and some of the things that he said is that, for instance, they say that they're a nonprofit, so they have little charity events that they engage in.
All right.
And they actually say that their charity events are only 1% of how much revenue they take in, because the majority of revenue is coming from patients. And the real issue that this person, the author, really addresses is that with the actual, the real issue that this author tries to address is that the costs of healthcare are so extremely high that Congress has been arguing about who's going to pay for all these things, insurance or Medicare or something like that, when what we really need to address is why are these costs so high?
Right.
Why do they make add 1,000% profit to a generic acetaminophen tablet?
Right. Now, I've been talking about the spiraling cost of healthcare for 4 years and how Obamacare didn't resolve any of these things. Well, clearly this nonprofit status on certain hospitals is giving them a tremendous profit. Take a look at here. It says, so what do these wealthy nonprofits do with the profit? In a trend similar to what we've seen in nonprofit colleges and universities, where there's been an arms race of sorts to use rising tuition to construct buildings, hospitals improve and expand facilities. And despite the fact that the U.S. has more hospital beds than it can fill, buy more equipment. They hire more people. They offer more services, buy rival hospitals, and then raise executive salaries because their operations have gotten so much larger. Again, there's a administrator in our area who gets about $850,000 a year just to be the president of a hospital. This is crazy, and that's a public hospital too. So unless we stop the rising cost of these healthcare providers, we're never going to get ahead of this problem, and Obamacare will end up funding this incredible beast of a greed machine called medicine. We are not seeing results as average Americans. Go ahead.
One of the issues that he tries to address in this bill is that, or in this article, is basically they have things called a charge master, which is that sets the prices for each hospital, how much they're going to charge a patient. And some hospitals say, well, we charge all the hospitals, everybody gets the same bill at the beginning, but it's not everybody pays the same amount. In fact, if people are too poor, they often qualify for Medicaid, or if they're older, they qualify for Medicare. And let's look at right now what Medicare and Medicaid would pay $13.95 for a certain test. It's called a troponin test.
Troponin blood test.
Correct. And they charge nearly $200 at Stanford, Connecticut Hospital, and up in Bridgeport Hospital, they charge $239 for that test that Medicare believes should only be charged $14.
Amazing. The differences are phenomenal. How could we possibly have an industry, the healthcare industry, charge different rates and different amounts for different people, different times? It's all variable. It violates contract law as we know it.
Exactly. Exactly. Everybody is charged something different when they come in. They would say, "Oh, they're all charged the same," but we work with the insurance companies and we work with Medicaid. But what about the people that can't afford advocates? There's certain advocates. Advocates, by the way, get paid $100, nearly $100 an hour to try to bring down the cost.
That's ridiculous. Healthcare advocates are paid $100 an hour to bring down the cost of patient care. This is interesting. Let's talk about the drug costs and all of the ways in which the healthcare providers lob this onto your bill, whether you're insured or not. And I must remind you folks, 85% of all medical bankruptcies are happening to people with full insurance plans. And there was another statistic that arrived last week that said that 9 million people in America who are currently healthcare insured will not be after Obamacare goes into place in 2014. Many companies are willing to pay the $2,500 penalty per person than to pay $10,000 a year for that person's healthcare insurance. And this is the same issue we've been talking about way before Obamacare, and it's finally hitting the Democrats who haven't really understood how this entire plan of theirs of all these excessive regulations would play out in the economy.
Okay, what I'm going to show you now is relative costs for different procedures in different countries. So Argentina, it charges for a CT head scan $78, an appendectomy $1,000, coronary bypass $9,319. And you can see the different costs as we go down the list. India, for instance, it charges $43 for a CT head scan. In the U.S., here are the differences. The biggest of all, $510 for a CT head scan, $13,000 for an appendectomy,
$67,583 for a coronary bypass. Way higher than some of the other nations around the world.
Than even Australia, which is the next highest one for that coronary bypass.
Right. So we are at the top.
Canada.
We are at the top of the list with healthcare costs, and the Republicans have been telling us that a public healthcare plan or a public option is impossible. We think it's not only possible, it's required as a solution to this problem. Remember, if we have more doctors in a public health care plans like a public option provider, we would very well lower the cost of health care. If we had mobile medical units in our cities around the country, we'd have lower health care costs for every American. And what we're going to show you is across the board, the healthcare is a major factor in personal finance. People are losing their shirt on the current cost of healthcare. Go ahead.
Yeah, 69% of those who've experienced medical bankruptcy were insured at the time of their filing.
Wow.
And 62% of bankruptcies, of all bankruptcies, are related to illness or medical bills. So it's really affected Americans, all these high costs of doctors. Now, one thing that I would like to say right now is that if you are someone who's received a bill in the mail, do not mortgage your house to pay for it.
No.
Let them put a lien on it because they can't kick you out. But don't mortgage your house to pay for it.
Their game is to just send you billings, multiple billings. And for some of you who bought the lie that Obama said there was no free health care, there is free health care for you right now.
Well, you can get treated.
If you have no money, you declare yourself indigent and you will get treated and guaranteed treatment. So don't in any way risk your life and avoid an ER ward because you're afraid of the bill.
At least you can get treated at what are considered public hospitals. Now, MD Anderson did have the gentleman from the beginning of the story. They had him waiting for 90 minutes to see a doctor.
And he was really hurting.
He was sweating. He had palpitations. They had him waiting for 90 minutes while the check cleared. He had non-Hodgkin's lymphoma, and he was waiting 90 minutes while the check cleared. This is the kind of greed that we don't want in healthcare. And a public option, like the one we're proposing at America's Third Party, the National Opt-in Plan, would prevent these excesses and would only cost the average consumer $50 a month, and it's not mandatory. You would simply have a full coverage plan
covered by the national government insurance plan. Very simple, and it would cover as many people that are in the system, and it would finance their healthcare costs with the bargaining power of a large organization like Medicaid or Medicare.
This is a tube of bacitracin. It was charged $108. It's just a common antibiotic that
Wow.
you can get at the
For $6 at the most at a drugstore. Yeah,
Exactly.
Unbelievable. Let's take a look down this road. Catastrophic illness and the bills to match. This is an article that goes on at times, and I really am glad that they did this because it really shows the American people that the healthcare costs really are way more of a problem than the issues addressed in Obamacare. Now, for some reason, Obama couldn't come up with a solution 4 years ago, so we have instead these crises. Now, let's talk about this. This is a funny one about niacin. Let's bring that up.
tablets.
Niacin tablets have been known to prevent heart disease. It's one of those secrets that cardiologists don't tell people.
It's, by the way, niacin is a simple vitamin that all women should take if you suspect you might be pregnant. And
one tablet.
One tablet, 500 milligrams, $24 because it was at the ER. This tablet you can get in drug stores for about a nickel a piece.
It's a vitamin.
$24 for something that usually you can get for a penny, 5 cents.
Well, let this be a word of warning, folks. If you go down and buy vitamins, you might very well be saving your life. This is something that you're going to get ripped off at a hospital when they give it to you. $1.50 for acetaminophen.
$1.50, yes, exactly.
Wow.
One tablet, not a bottle, one tablet.
Unreal. So let's take a look at the rest of the article. We did make copies of everything just to make sure that we had a comprehensive look at what's happening. Apparently there's the cancer drug food chain going on. They're trying to make money on the cancer industry with radiation and chemotherapy. They're just taking everything we've got, and folks, they're not solving the problems. Oftentimes, this chemotherapy is a smokescreen. It doesn't solve anything. Now, this is Mr. Bloom, Jonathan Bloom, who is an administrator at a hospital, and he said that when hospitals say they're losing money on Medicare, his reaction is that the Central Florida is that it's overflowing with Medicare patients, and all these hospitals are expanding and advertising for Medicare patients. So the idea that people are losing money on the Medicare bills that we just saw, it's not true. Hospitals are just raking it in from the government as fast as they can get it. What was that, 1.5 billion a day? Take a look at that.
Let's
zoom in on that.
I haven't read through that.
Well, we're going to read it right now with the people watching our show. Sloan Kettering sends an Allen A's bills to Medicare electronically, all elaborately coded according to Medicare rules. There are two kinds of codes for the services billed. The first is a number identifying which of the 7,000 procedures were performed by a doctor, such as examining a chest, etc., etc. If a patient presents with more complicated challenges, then these basic procedures will be coded differently. For example, there are two varieties of emergency room consultations. These adjustments are also made for variations in the cost of living where the doctor works or other factors. So apparently they charge everybody different rates as they walk in the door. And there's no one that can do this in any other industry.
Exactly. And one of the things is that they actually, with these that they do it in no other industry, is that it's the charge master that they have is different for every single hospital as well. And the charge master is often what Medicare has chosen is Medicare, by the way, when they decide how much they are going to pay, they take into a factor things like overhead.
Right.
They take into consideration things like how much do nurses get paid per hour, how much do doctors get paid per hour, and they actually make it if not fair, maybe even more so because they're getting so lobbied.
Okay, let's take a look at this. This is really interesting. The profit of prestigious cancer care. Like MD Anderson's aggressive pricing, Sloan Kettering's markup on drugs are also one reason cancer care is so profitable. In 2011, the Hospital and Research Institute of Sloan Kettering had an operating profit of $406 million, folks.
And that's after when they talk about an operating profit, they're talking about pure profit. They're talking about after they pay the doctors, after they pay the nurses, after they pay for all their overhead, their lighting, their equipment costs. Operating profit $406 million for Sloan Kettering.
Unbelievable. Let's see, are we done with this article? Because I want to.
Yes,
we're almost
pretty much.
done. Obviously, we've got a few more things to go through. Did you go over this section?
No.
Not really. Okay, it continues on, folks. If you want to get the article, is in Time Magazine's their current special
March
edition.
4th,
Yeah, March 4th edition.
Exactly. So, yeah, it's a really good article, and we definitely need to bring up. This is a very good article, and we definitely need to start discussing healthcare and the costs of healthcare more in depth.
I'm going to give a summation as to what's happening. I want all of you to know that over the past few years, TARP 1 and TARP 2, over the past 5 years, have put out approximately $3 trillion. The current easement of money going on by Ben Bernanke, $85 billion for mortgage-backed security buyouts every single month, comes to another total of $3.1 trillion. That's $6.1 trillion. And when you add to that the overspending of Barack Obama over the past few years,
Yes.
you're looking at $10 trillion that could have gone to social programs. We could have actually
Exactly.
financed a welfare state, for that matter.
We could have had public hospitals.
We could have had
and
public
truly
hospitals.
something that's non-profit rather than paying these CEOs
Of big banks.
$1 million salaries.
These big banks have gotten huge salaries. The SEC turned a blind eye to what was going on in the mortgage industry and continues to neglect to prosecute anyone in Wall Street or in the banking community that were responsible for the terrible excesses that occurred during that time period. And they're still profiting. So the $9-10 trillion that Ben Bernanke has authorized in spending is really something that could have easily helped our economy rebound. And you imagine if everyone got a welfare check, for that matter, they would have used it spending money in the economy, not sitting and investing in Dubai and China like many banks did during the TARP period.
So true. So true. And they still have had to bail out with this $85 billion a month in mortgage-backed securities.
So we're going to need to put the brakes on not only the banks, but on the two-party system, which is basically supported by the banks. And that's why we have created America's Third Party. And we conduct our show every single weeknight at 6 o'clock till 8 o'clock Pacific Standard Time on Blog TV, and we talk to you in real time.
Yeah, join us this week or any weeknight that you'd like. And you can also get there at tinyurl.com/ATPblogTV.
Every one of our show nights is a theme night, so you'll be encountering different subjects every single night, but you can always talk about what's really hot on your griddle in your area, that we can actually come to some solutions to find a way in which we can be fiscally conservative and socially liberal at the same time. I'm basically doing this, and Sarah's doing this, because we believe that average Americans can solve the problem better than these academics that have failed to begin to solve our economic woes. I'm David John Sponheim for America's Third Party.
I'm Sarah Hart. Thank you for watching.